Hi, my name is Amanda Powell, and I'm with ECPI University, currently enrolled in the Community Health course. And today I'm going to be talking about how to manage life with hypertension. And we're going to talk about this by how to recognize the symptoms, how to change your diet, and then how to monitor your blood pressure at home. So first, I want to talk about what hypertension actually is. So hypertension, it's described as a condition in which the force of blood against artery walls is too high. So to measure this force, we use a stethoscope and a blood pressure cuff to determine the blood pressure. It's going to give us a number, a top number and a bottom number. So the top number, or the systolic pressure, measures the pressure in the arteries when the heart beats or when it contracts. And then the bottom number, or the diastolic pressure, measures the pressure in the arteries between heartbeats or when it's at rest. I've included a picture under this video. There's a brochure that I put in the comments below, and there's a picture of a vessel or an artery. So one side of that artery is a normal size, and then the other side of that is a hypertensive artery. And you can really see how the difference in the diameter of the vessel is. So when you have that hypertensive artery, the lining of the wall is really thick, and it creates a small diameter inside the vessel. This makes it difficult for blood to travel through. So the body has to put more pressure in there in order to force the blood through the vessel and throughout the rest of the body, therefore creating a higher blood pressure. So hypertension is diagnosed if the top number or systolic number is above 130, or the bottom number or diastolic number is above 80. So it could be either or. You could have a blood pressure of 170 over 80 and still be considered hypertensive. It doesn't have to be both numbers elevated. It can be one or the other. So that's just something important to remember. When talking about signs and symptoms, some people have absolutely no signs of high blood pressure, while others might experience headaches or nosebleeds or confusion. Some people have some vision changes or even some chest pain as well. And when talking about low blood pressure, or also called hypotension, some people feel dizzy, they feel lightheaded, just a lot of blurry vision, really just generalized overall weakness. There's also some fainting involved as well, especially when going from a sitting or a lying position to a standing position. There tends to be some fainting as well with that. So if you experience any of these symptoms, I highly encourage you to schedule a visit with your provider to discuss this further. I also want to point out that hypertension is often called the silent killer. Now, it's called the silent killer because oftentimes it can present without any obvious symptoms. So, because of this, it's really, really important to visit your doctor routinely, have your blood pressure checked, even if you have no symptoms, so that this hypertension can be caught before it becomes an actual health problem. So now that we know what blood pressure is, I want to spend some time on the benefits of a healthy diet that can either prevent or help you manage your hypertension. A really good rule of thumb to follow is what we call the DASH eating plan. Now, DASH, DASH, it stands for Dietary Approaches to Stop Hypertension. This eating plan focuses on limiting things like sodium, red meats, sweets, added sugar drinks like juices. So decreasing your sodium intake, it means more than just not adding salt to your mashed potatoes at the dinner table, right? There's some other things that we need to remember when choosing our food. So some basic foods that are high in sodium are your soups, broths, fast foods, sauces like barbecue sauce, or processed foods like lunch meat and frozen dinners. The American Heart Association suggests to try to limit what they call the salty six. Now, this includes number one, breads like bagels, flour tortillas, or rolls. Number two, cold cuts and cured meats. Number three, pizza. Number four, poultry. Number five, soups. And number six, sandwiches. So this is a really good kind of rule of thumb to gauge your sodium foods, or your foods that are high in sodium. So I've also included this in the brochure that's below. Just for your reference. So it's all listed there for your reference as well when making your selections. So I know that it seems like this cuts out a lot of your eating options. The DASH eating plan really limits what you can have. So I want to remind you that DASH encourages some heart healthy options. So these are things like a variety of colors in your fruits and vegetables. So eating a heart healthy diet, it should include 3 to 4 servings of different fruits and vegetables every single day. So additionally, you should incorporate at least half of the grains you consume should be high fiber whole grains. So some examples of this are things like brown rice, whole grain crackers, whole wheat bread. You don't have to cut out all of your carbohydrates or all of your starchy foods. Just try to make 50% of those whole grain choices. Eating a diet high in lean protein is another way to eat heart healthy. So some lean protein options are things like fish, lean ground beef or extra lean ground beef. You can get the 97 or I'm sorry, 93.7% ground beef. That's a really good option. It's low in fat. You can also do eggs or tofu. So remember to limit consuming processed red meats too, like bacon, salami, ham, hot dogs. These choices are usually really high in sodium, so you want to be careful when making your meat and your protein choices. A good option for healthy fats and high protein are beans, things like black beans, kidney beans, pinto beans. You could also do unsalted nuts or even some low fat cheeses are really good options for snacks or to include in your meals throughout the day. So now that you've been diagnosed with hypertension, you need to get a cuff and check your blood pressure at home. So how are we going to do that? Where do we even start? First, let's talk about where you get one. So you can purchase a blood pressure cuff at just about any pharmacy around. You can even order one online. You do not have to have a prescription for this. So you can get one pretty much anywhere pretty easily as well. When selecting one though, there's a couple of things that I want to talk to you about. So you want to make sure you have the right size. Most people use a standard cuff, but you want to be sure of your size because if you have the wrong fit, it can produce an incorrect reading or false reading. So we want to make sure that we have a good fit. So to know what size is right for you, you are going to look at, I have a blood pressure cuff here. And this is the outfit. This is a manual cuff also, by the way. If you get one that you're testing from home with, you're going to have your cuff is going to be connected to a machine. So it's not going to be individual like this one is, but it's the same. The cuff itself is the same concept. So you're going to look at the bladder of the cuff. Okay. So the inside of the cuff, which is here, we're going to look here, and the bladder of the cuff is this part right here. This is the Velcro side. So this part right here is your bladder of the cuff. This portion should cover 80% of the upper part of your arm. Either arm is fine, but it should cover 80% of your arm. If you put your blood pressure cuff on and it is not covering 80%, let's say it's covering 40%, it's not covering, it's only covering a little bit, then you need to get a smaller cuff. This cuff is too big for you. Likewise, if you put it on and it's wrapping around to here, it's covering up 100% of your arm or more, you need to get a bigger cuff. This cuff is too small for you. So that's really important to know to make sure that you're getting a good accurate reading. So before you hit go on your machine, there's a few things we need to check off first. So I want to make sure that you're aware you want to check your blood pressure around the same time every day. And then as well as doing that, you want to be using the same arm. Either arm is fine unless you've been told by a provider not to use a specific arm for whatever reason. You want to use the same arm at the same time. So pick a time that's convenient for you and that you can remember. That you can do every single day. You want to make sure that you are seated in an upright position and that your legs are uncrossed. You also want to make sure you're remaining still during the measurements. You don't want to be like talking on the phone or cooking or doing other things. We want to be nice and still, relaxed, so that we get a good, accurate reading. Another really good tip that a lot of people don't talk about is to empty your bladder. So empty your bladder before that can cause elevated blood pressure. If you have a full bladder, so empty your bladder before you test. Additionally, we want to make sure that you haven't had recent exercise or had caffeine right before you take. These things all can temporarily increase your blood pressure. So we want to get the best most accurate reading as possible. So try to make sure that it's been, 30 minutes or more since you've had any of these things before you actually hit go on your machine. So when placing the blood pressure cuff, it needs to be placed 2 to 3 centimeters above the elbow joint right here. Okay. So you're going to place, this cuff either directly on the skin or over a thin shirt. This is a really thin sweater that I have on right now. So this would be okay to do over. If you had a thick coat or a really thick sweater or jean jacket, something like that, you'd want to remove that. It needs to be a really thin shirt or on the actual skin when doing the blood pressure check. You're going to also line up the marked arrow on your blood pressure cuff to the artery on your arm. So I'm going to show you how to do that as well. On your cuff so we had the bladder was on the inside. So the outside, we have a little arrow here that says artery with an arrow right here. And we're going to line this up with the artery in our arm. So your artery runs through right above your elbow joint. So that's kind of what we're going to use as a guide. You're going to line, when you're putting your cuff on, I'm trying to show you guys this, the marked artery arrow on your cuff is going to line up with the artery that runs through your arm. Okay, so it's going to lay just like that. And then you're going to, you also want to make sure that your arm is supported at arm level. So you can rest it like on a table, or something that's at arm level. You don't want to let it hang down, and you don't want it to be way up high either. You want to make sure that it's at heart level. And then, to secure it, you're just going to kind of wrap it around, and not super tight, not super loose, but snug. Okay. So now we're lined up. Our marking is correct. Show you. We're lined up. I'm sitting up straight. I am nice and still. I haven't had any caffeine, and I'm ready to test. So I'm going to go ahead and hit go on my machine. My legs are uncrossed, and we're going to let it run. When you get your number at the end of the test, you want to record that number exactly. If you get 174 over 80, you want to write 174 over 80. You don't want to round down and write 170 over 80. You want to be as precise as possible, because you're going to give this information to your doctor to make sure that your blood pressure is controlled. That's the point of all this, right? So we want to be as accurate as possible. Also, when you're doing your machine, you want to make sure that your equipment is always in good working order, that you have your machine either recalibrated or replaced every 2 years. So you don't want to be using the same machine for 10 years. We want to make sure that we're getting accurate, good readings. So just pay attention to that. I've also included this information in the brochure below, and you can use this for reference. It's a guideline of how to test, how you should be positioned when you're testing at home as well. So I hope that you've learned something today, and I just ask that you take the short quiz after the video. This is just for me to ensure that the information I'm giving out is understandable, and that it's been helpful, and that you've actually learned something. That's my intention for this presentation. So thank you so much for watching. If you've learned something, then thank you again for watching.